Cialis is a treatment for erectile dysfunction, impotence, erectile dysfunction in men. The drug dilates the blood vessels of the penis during sexual arousal. As a result, blood circulation in the penis increases, and this, in turn, contributes to the onset of a stable erection. How should I use this medication? On-demand dosing. The usual recommended dose is 20 mg taken as needed, at least 30 minutes before sexual activity. This medication has been shown to be effective within 13 minutes of taking the tablet and last up to 36 hours later, as the amount of time Tadalafil takes to work varies from person to person. Starting sexual activity at different times after taking the tablet will determine the optimal time for sexual activity. The maximum recommended amount of medication to take is 1 tablet a day. Once a day use. The usual recommended dose is 5 mg per day, taken at about the same time each day and regardless of when sexual activity is planned. The daily dose may be lowered by your doctor if necessary. Tadalafil may be taken with or without food. Contraindications. Simultaneous administration of drug containing any organic nitrites, age up to 18 years, hypersensitivity to the component of the drug. Special conditions. Sexual activity has a potential risk for patients with cardiovascular disease. Therefore, the treatment of erectile dysfunction, including with the use of the drug, Cialis shall not be carried out in men with heart disease, in which sexual activity is not recommended. The safety and efficacy of the combination of Cialis with other treatments for erectile dysfunction have not been studied. Therefore, the use of such combinations is not recommended. Side effects. Side effects are usually mild or moderate in severity, transient, and decrease with continued use of the drug. Most common: headache, dyspepsia. Possible: back pain, myalgia, nasal congestion, flushing of the face. Rarely: swelling of the eyelids, eye pain, conjunctival hyperemia, dizziness. Very rare. Hypersensitivity reactions, arterial hypertension, hypertension and syncope, abdominal pain and gastroesophageal reflux, hyperhidrosis, excessive sweating, priapism and erection delay, blurred vision, retinal vein occlusion, visual field impairment.